Joining us once again to answer your questions, Dr. Gary Berner with the Community Clinic of Northwest Arkansas. Dr. Berner, thanks so much once again for your time.
Absolutely. Happy to be here. Thank you.
First of all, how is the clinic holding up? How are doctors and nurses, and has the amount of tests been increasing so far?
We're holding up. A lot of our team has just been really resilient in this time period, just showing incredible flexibility. We are, if not hourly, certainly by the day, making changes in our clinic and our clinic processes. We had one of our outdoor testing treatment sites in Prairie Grove, and we've moved that over to our Fayetteville clinic just to accommodate the community needs. We're increasing our services, adding another outdoor site in Springdale at our main campus there as well. So our providers, our nurses, our medical assistants have just been really flexible. And, we're sharing the same fear and anxiety of the unknown and of the current concerns as the rest of the community. So just really been impressed with our team and at Community Clinic, but of course across Northwest Arkansas with Regional and Mercy and Northwest at how we're responding to the coronavirus pandemic. In terms of testing, we continue to really see that ramped up. I believe I saw this morning that 16 patients were confirmed positive in Washington County. But we are aware that there's likely significantly more to come. Quite a few folks that have been tested, very likely to be positive, but that result just isn't back yet. So certainly the number of tests we're sending out have increased.
Yeah, this health crisis is very unnerving for all of us, so we truly appreciate all the work that you doctors and nurses are doing for us, for all of Northwest Arkansas. Let's take a look at another question. The number of COVID-19 cases, of course, just keeps on rising here in the state. 473 cases as of this afternoon, 7 deaths, and 21 people on ventilators. The governor announcing that he ordered 500 ventilators last week. Is this enough? Many hospitals across the country are seeing shortages now in equipment. Is this a problem that you're hearing about or seeing here in our area?
So I'm glad that they're continuing to, update our supplies. I've heard of huge numbers of protective equipment that have been ordered to get there for our staff members to continue to take care of our patients. I can't speak directly to 500 ventilators, but overall, we're going to have to continue to be very proactive. So that means putting in orders well before the need is there. Our clinic is already even though we've just gotten a shipment in, we've already put in for more with the expectation that is going to continue to increase. So 500 ventilators might be okay for now, but it's likely that the state is going to have to continue to be very proactive. Each individual testing center, like Community Clinic, has have to be very proactive on staying on top of its equipment, because what's enough for today is only speaking for today and maybe the rest of this week. But this situation is just changing rapidly, and all the health centers and hospitals are having to adjust accordingly.
In terms of fighting COVID-19, Arkansas Secretary of Health Dr. Nate Smith announced last week that plasma from recovered COVID-19 patients is a promising way to treat critically ill patients. What is it about plasma specifically that could help?
That's a great question. It's certainly a little bit confusing. But the beauty of our immune system is that as we get exposed to something, whether that's through a vaccine or an allergy, the common cold or coronavirus, it begins to adapt. And so when a person gets coronavirus, their body starts working and adapting its immune system to then take care of the coronavirus. And as it builds up antibodies, then it's able to alert the rest of the immune system to attack the coronavirus and fight it off. So in patients that have recovered from coronavirus, then their immune system has developed antibodies that can then help to fight off coronavirus. So the hope is, and what we're seeing, is that then if someone's recovered, they could share their antibodies with someone that's fighting the coronavirus that hasn't had the time to develop their own antibodies. So it's almost kind of like sharing someone's immune system, and that's how plasma works. Is someone can share what they've already developed, basically share their experience of getting over the coronavirus, and give that to another person through their plasma. That's a very rough look at it, but gives you the basics of how it might work.
Yeah, very fascinating. A question that we're getting a lot from viewers, they're unclear on this one. People are being told to stay home, but also they're being told it's okay to go outside for walks. Can you explain how it's safe to be outside?
Absolutely. In some ways, in a socially distance, not being around other people, being outdoors provides a lot of safety because of the air movement. Indoors, unless you're in a hospital with what we call a negative air pressure room, that's actively sucking the air out of the room, um, outdoors is a safe place to be because of that continuous airflow and movement. That's why at community clinic we've set up testing sites and treatment sites that are outdoors because we have that constant airflow movement as opposed to being indoors in a small patient room with someone that could have potentially coughed, and those respiratory secretions may stay in the room. So in terms of being outdoors and what's safe and what's unsafe, um, what I would recommend doing, going for walks, but doing that in small groups and the people that you live with. Not, joining up with other families or joining up with your friends to go on a group walk together, but keeping that same social distancing approach that you do indoors, outdoors as well. So if you live with 3 people, that would seem very reasonable for that small group to go on a walk together. However, I would not recommend joining up with other families and having a group outing together, as sometimes we're seeing.
Yeah, that makes sense. I think that really did help clarify that concern. Many people in our communities are taking to making masks to help lower the spread of the virus here. We're clear they are not medical grade masks, not N95s, but are they still helpful or effective?
We haven't had the ability to test the homemade masks. And it's also, some people are making them out of cotton and other people making them out of nylon and so many different variables there that it's tough to know how effective the homemade masks are. So, you've got to think that something is better than nothing, but we really don't know how effective the homemade masks are because scientific trials haven't been able to study those, as well as there's so many variables in terms of how tightly does it fit, what material is it made of, how old is it, and a lot of different things that can change depending on who's making it.
Hygiene, of course, top of mind, and right now it's hard. I went to the store the other day and only found 1 bottle of soap, so that's hard to come by. Hand sanitizer as well. What if someone finds an old bottle of hand sanitizer? Is it still safe to use, even if it's expired?
I can't necessarily recommend expired hand sanitizer. Really tough to know, what would happen, how well the bottle was made, and so many variables there. So I can't recommend it. Many times the effectiveness has reduced, but it still is partially effective. So probably something better than nothing. But ideally, I'd try a different grocery store. I've had the best success going first thing in the morning and trying to find yourself some soap that isn't expired. In general, I've typically been able to find soap even when the hand sanitizer is all out and purchased. So try going first thing in the morning to find some soap and you'll probably have a little bit better success.
All right, good to know. Another popular question is about grocery shopping and pickup orders from restaurants. How can we ensure our safety when we go to the store, especially when it comes to fruits, vegetables, raw foods, and then also those to-go orders?
One thing I'd recommend doing, whether that's someone coming into your house that may work in the service industry, or if you're doing it to go to a restaurant or going to a grocery store, ask to speak about how they are protecting you. If they're taking measures like evaluating their own employees' symptoms, are they checking for fever and cough? Are they evaluating their own employees' hand hygiene? If they're taking those measures, that really sounds like they're going the extra step to ensure your safety. If they're not really able to give you an answer of what they're doing, that'd probably be a place that I would avoid. At this time, any establishment really has had the time to develop measures, even if they're going to change. Right now, they should already have measures in place to help to decrease possible contagiousness of their employees, and increase the safety of anybody that wants to come by and pick up food, whether that's a grocery store or a restaurant. So reach out to them and call ahead and find out what they're doing to help keep everyone safe.
Yeah, good advice. We all need to be as proactive as possible as this just continues to change and spread here in our country. Dr. Berner, thank you once again for your time and your knowledge with COVID-19.
Absolutely. We're happy to help any way. Give us a call if you need anything. Thanks so much.